We are honored to have back with us Dr. Peter McCullough of the Wellness Company. He's a friend of the show. We've interviewed him many times. And Doc, there's some breaking news going on right now. Tell us about what's happening.
Yes, breaking news. It looks like a crack in the dam of the vaccine cartel. The Advisory Committee on Immunization Practices, after receiving enormous public pressure, Todd, enormous public pressure, has finally dropped the recommendation for universal hepatitis B vaccination in newborns, first day of life. And this practice of vaccinating every single baby in America on the first day of life for hepatitis B started in 1991 when the public health community could not convince prostitutes and others carrying hepatitis B to take the vaccines. Mm-hmm. And in a New York Times editorial published in 1991, it said, listen, if we can't get the prostitutes to come in and get shots, we're just going to give them to all the babies. And they made the mistake of assuming that babies getting a series of shots would provide lifelong protection. And Todd, it doesn't. It doesn't provide lifelong protection. Now studies show by the time people are adults, they have no protection against hepatitis B. So it makes sense. Every single year, there's 3.6 million live births in the United States, and there's about 25,000 women who, are carrying hepatitis B, largely those in the sex trafficking field, IV drug abuse, and others. And so we've been over-vaccinating 3.6 million babies just really for the 25,000 births that do need the vaccine at the time of birth. And there's universal testing done in each and every mother. So it's clear that every mother, every normal mother who's hepatitis B negative, their child does not need the shot. And now the hospitals will no longer have to give it as a matter of routine schedule.
So that begs the question, if we were testing and we knew who had it, why give it to all those other babies? Was it just a money thing, or what do you think?
It looks like it was a big money grab. I was paying attention to the deliberations of the committee, and the first day was yesterday. They couldn't agree on things.
I saw that.
That's normal not to agree. Do you know previously that committee, which was rife with conflict of interest, all these people had ties to the vaccine cartel, they just voted universally to always have more and more vaccines given to children. They never questioned them. For the first time, we've got a committee and it was a split vote. It was 8-3. That's fine. But finally, the hepatitis B vaccine being dropped essentially for 3.6 million normal babies who don't need it. Later on in life, Todd, you get to be adult and you're going to be a first responder, a doctor, a nurse. Then it's reasonable to get a hepatitis B shot. I've gotten them, at that proper juncture. And even Trump was on, they showed a clip of Trump last night. I was on Fox Business Evening Edit with Liz McDonald. And even Trump came out and said, listen, hepatitis B for a normal baby, it doesn't, make any sense whatsoever. Trump said, let's wait on it. And it isn't amazing that we have to have a president weigh in and finally put pressure on a committee to break this vaccine grip on America.
It really is amazing. And well, just for our audience sake, what is the consequence or health effects in the negative sense that vaccine has produced?
Well, it's unnecessary because there's no adequate protection in the teenage years when sexual contact occurs, or later on working in healthcare. There's no protection, so you have to redo the entire schedule. And now the committee looked at safety reports for the first time. Again, if every single baby in the United States gets this shot, every single day that a baby's born, that's 3.6 million shots. Of course, there's going to be side effects. And the committee looked at, over 5,000 serious adverse events. Of course, there can be allergic reactions. And, it's a cause of the baby to get a fever on the first day of life. And I don't know if you remember when you had your kids, Todd, but when a child gets a fever on the first day of life, we don't know if it's neonatal sepsis. So many times the babies have to go through blood cultures, urine cultures, spinal tap. All of that's unnecessary because they've just gotten a vaccine that's caused the fever.
Wow. Well, let's move on to some other breaking news. There's change at the CDC, I understand, on some of the autism issues. Explain it for our audience, please.
Oh, this was really big, Todd. McCullough Foundation published a critical scientific report, and I'll hold it up. It was published on October 27th, 2025 with a press release. It was published on the European Commission Open Air Zenodo server. It's a total of 127 pages, hundreds of references. And the conclusion here is that bundles of vaccines given to small babies, susceptible babies, is a risk factor for the development of autism spectrum disorder. Now, we use the term risk factors because there's other risks, including older parents, premature delivery, some common genetic variants, some drugs a woman could take during pregnancy. And the big ones were antidepressants, anti-epileptics, and antipsychotics, not Tylenol, by the way. Acetaminophen, we don't have to worry about that. That's been ruled out. And then, of course, getting a big bundle of vaccines. Importantly, we examined 29 studies that said they can't find any link between vaccines and autism, and not a single one of those studies was valid, Todd. Those studies did not interview the parents. They didn't examine the parents' vaccine record that they held for the child. They didn't examine the child himself or herself to see if they were normal or had autism. And none of them had a control group of truly unvaccinated children, that there was vaccines being given in both groups. So they were invalid. The CDC, 3 weeks after our report, now is supported by their changes. And the CDC says on their website now, prior statements that vaccines don't cause autism, they weren't evidence-based. And the CDC has said they're going to do their own report, and I've strongly encouraged them to do their own report. But this is very, very important. Young parents now should take a look at this and do their own research.
I've had a lot of young parents, confused. I mean, they hear the line, they're worried about, not vaccinating their kids, and maybe that'll hurt them or get them a disease. But how do parents best get educated, do you think?
Well, I think every parent should read the McCullough Foundation report on the determinants of autism spectrum disorder. It's the most definitive report out there. In fact, we just took an interview from CBS and so many of the major stations now carrying it. Importantly, table 4 in the manuscript, Todd, outlines there's 12 papers in the modern day of cleanliness and good air, nutrition, water, and with testing and antibiotics and corticosteroids and other treatments, that in today's world, a normal, healthy child born today remains healthier if they take no vaccines whatsoever. And, I even said that on Fox Business last night on national TV. And so, the word is out. More and more parents now, Todd, are going natural.
Wow. So you had the WHO come out. I forget who reported it, but they put out a report saying that, there has to be this vaccine surveillance system. Everybody has to be vaccinated. We have to make sure everybody gets it globally. So that's what we're up against. But your type of group has become much more powerful to confront that type of thing, isn't it? Or hasn't it?
Well, the scientific truth is powerful. We don't use propaganda terms like misinformation or anti-vaxxer. Those terms don't have any role in public health and discourse. The WHO has said that medical misinformation is a threat to public health.
Right.
Well, they don't hold agency over the truth. There are emerging scientific observations, multiple points of view, and it's through discussion and debate and disagreement. That's fine. That's how we approximate the truth. We are finally starting to see that under Trump and Robert F. Kennedy now in the Health and Human Services Division. I think it's very welcome.
And do you think that'll continue? I know there's a massive pushback internally. Do you think it will get more and more strength?
That's a good observation, Todd. What people are telling me inside Washington, they're telling me that there is a biomedical deep state. Just like there's a deep state in the intelligence community and in the Defense Department, that there's a deep state of entrenched employees that are prioritizing their own personal employment situation or political gain over the best aspirations for the country. But one of the best examples is the CDC. The CDC has 12,000 employees, Todd, MDs, PhDs, MPHs, mainly highly educated people, 12,000. a
Yeah.
$9 billion budget. They don't operate any hospitals or clinics. They don't directly treat anyone. They do some research, and they operate some laboratories and some research networks. But they're largely to provide advice to me, a doctor in the field, and doctors at the wellness company who are practicing medicine. 12,000 employees, $9 billion, Todd. I can tell you, I think that number should be less than 1,000, to be honest with you. It's a gross example of a biomedical deep state. And you know what, Todd, we know a deep state is present because you know what just happened over Thanksgiving holidays. This is a stunning development. Some well-intentioned person at the FDA leaked out 10 deaths in children after COVID-19 vaccination.
So there's definitely a biomedical deep state. There's also a media deep state. With, all these entities that are so well funded, they're almost way overfunded. If we just had an inkling of the kind of money that they had, we could do, and you could do a lot more good. Let me ask you, the wellness company in that vein has made, I've watched it unfold over the last several years. I mean, it's really made a difference in healthcare for Americans. Tell us about that and what's behind that.
Part of what the wellness company is doing, and with partnerships like CDM Media, is bringing people the truth. And just to finish this FDA leak, FDA said they had 96 case reports of death in children after the vaccine, Todd. This is terrible. 10 of which they're certain the vaccine is a cause of death. I want to see all 96. And now one of the junior staff members at the FDA, Prasad, he's out trying to do damage control in the media. This is a classic misleading technique called limited disclosure. That is, leak a little bit when it's really bad. You know, the CDC has over 19,500 deaths registered through the Vaccine Adverse Event Reporting System, reported by doctors like myself. We've already determined the vaccine is a cause of death. So to tell us they have 10 when we know there's 19,500, I got to tell you what, Todd, I think this is a trickle that's going to turn into a flood. And we should get these COVID vaccines off the market. We should do an investigation, independent investigation, adjudicate all these events, and tell America the truth. And the wellness company's been behind that. We have been critical of the government, but we've also worked to provide solutions.
That's critical, as you say. So you've got a lot of new products. One of them caught my eye because I remember seeing the Bobby Kennedy on the plane with his, blue dropper. Tell us about this TheraBlue stuff that you've come up with. What is this?
I'm using it right now, Todd. I tell you have to get some TheraBlue. TheraBlue is a topical lotion you rub into your joints, and you do it every day. Now, it does provide some immediate pain relief because it has menthol and other botanicals, but it recharges cells with methylene blue. And very importantly, it has over a half a dozen peptides, small amino acid sequences that penetrate the skin into joints, help the joints regenerate cartilage, ligaments, soft tissues. They really revitalize the joints. And what happens to a lot of us, we get older. I'm in my 60s, and my knees don't hurt, but they feel old, particularly when I run. You know what I mean, Todd? I've been using TheraBlue. I just ran the Dallas Turkey Trot. I felt great. I'm going to run today. So get TheraBlue and just use it every day, not just when you have pain.
Really interesting. So any other, new stuff you're bringing out to the market? Because you have a lot coming out. It's hard to keep up with it.
Right. Some key products. We've addressed this issue, Todd. Have you heard about men taking testosterone shots and women getting hormone pellets?
Yes.
Yeah, that's an entire industry. And, at the wellness company, we believe a natural approach should be considered first. So we've come up with Mars. Mars is a supplement that, again, has over half a dozen ingredients that stimulate the Leydig cells in the testes to produce their own testosterone. So that the testicles, become more active. They certainly produce more testosterone. Every single ingredient has supportive data. So instead of shrinking the testicles with testosterone synthetic shots, now the testicles are pumped up with Mars. So we're telling men if their testosterone level's low and they feel like they've lost some of their vitality, get Mars. Now, it's going to take 6 to 12 months or longer, but it's way better than taking testosterone shots. Now, for women have been taking patches and pellets and other things, but what they really need is a rebalancing of the principal hormones, testosterone, estrogen, and progesterone. And so that's done through the woman's product that matches Mars, and it's called Venus. And again, it's natural botanicals that all work to rebalance hormones. We think this is far safer and far more reasonable in this area. And boy, are they very popular.
I can imagine, because that's everybody has that issue. I was sent a copy. This is the Mars product here, so a sample.
Oh, you got it. Okay, good.
So there's so much news going on. Is there anything that people should be looking for? Maybe some rulings coming down the pike, or anything of importance that you know of in the near future?
Yeah, I think some of the biggest things we should watch is the state of Florida and what happens with vaccine requirements for school. Remember, part of this Make America Healthy Again movement is to drop vaccine requirements and mandates of any type. So just like any medicine, that we have a free choice on whether or not we take them or don't take them. We don't want, our kids' education to be dependent on taking a vaccine that the parents don't think is safe or the kids don't need. So Florida Surgeon General Joe Ladapo, my colleague, an MD, PhD, Harvard trained, former UCLA faculty, Joe has put forward as Surgeon General legislation that would eliminate all these school requirements. This is really big because, the diseases are the same, by the way, and they're very rare. Diphtheria, pertussis, measles, mumps, they're very, very rare now. Polio hasn't been in the water supply for decades. And, the diseases are rare and the same, yet in California, New York, Connecticut, the kids are essentially forced into the vaccine schedule. States like Texas and Florida, they can opt out easily. And I think soon Florida may drop the requirements altogether.
Talk about big news and big money. That it really is something to look forward to. We'll watch out for that. Anything else you want to get out to the world, Doc?
Well, I just want everybody to follow us. Go to the Wellness Company now, sign up, follow the promo code for CDM. Memberships are rich in terms of the provisions. We have free drugs coming through our prescription pharmacy. So I'm a member. I get my blood pressure medicines, and my wife gets her thyroid medicines, and for free through Pharmacy Mart. That's a Wellness Company pharmacy. And you get free supplements every month. I just ordered them. Make sure that you get a membership. Once you get a membership, not only do you get free medications and supplements, then you get deep discounts. That's when you want to buy one of the emergency medical kits. And we have a whole array of these kits. We just relied on one for my wife, who got an infected hand when she was traveling. It would have been definitely an ER visit, but we pulled her out of it with the Wellness Company emergency kits. And be sure you look for our new innovative products in the future. We just keep coming up with more and more, providing solutions where the mainstream medical system has failed.
It really is. You're re-engineering medicine, to use a Harvard Business School term. Thank you so much, Doc. Really appreciate your time. Always enjoy it.
Thank you.
Take care.